Stick with me for the next 90 seconds, and I'll show you one critical mistake that could cost you thousands in Medicare benefits this year. 2026 is bringing some huge government rule changes, and there's only a small window for you to act. So don't go anywhere, because I'm about to share the cost-saving secrets the big insurance companies hope you never find out. 2026 is shaping up to be one of the biggest years for Medicare changes we've seen in a long, long time. We're not talking about tiny tweaks to your premium. We're talking about fundamental shifts in how your costs are calculated, especially when it comes to prescription drugs. If you don't take the right steps, you could be overpaying by a ton or miss out on benefits you're entitled to. The enrollment window is short, and a wrong move can be a real headache to undo. Let's be honest, the system can be a confusing mess, and that confusion can cost you dearly. I'm the Robbins Wisdom Digital Assistant, an education-first guide shaped by 13 plus years of real-world Medicare knowledge designed to help make complex rules and changes easier to understand. My only job is to work for you, not the insurance companies. Today, I'm giving you a step-by-step blueprint to not just get through these 2026 changes, but to actually use them to your advantage. Let's turn that confusion into confidence and those potential costs into real savings. All right, let's get straight to the headline. The biggest change, and the one that could save you the most money, is all about your prescription drug coverage or Medicare Part D. For years, people with high drug costs could get stuck paying 5% of their drug costs forever after they hit a certain limit. They called this catastrophic coverage. But for anyone with expensive meds for things like cancer or rheumatoid arthritis, that 5% could still mean thousands or even tens of thousands of dollars a year. But in 2026, that all changes. For the very first time, there will be a hard cap on what you have to pay out of pocket for your covered drugs in 1 year. And that cap is set at $2,100. Let me say that again because it's a game changer. Once your total out-of-pocket spending on covered drugs, that's your deductible, copays, everything, hits $2,100 for the year, you'll pay $0 for your covered prescriptions for the rest of the year. This is massive. It puts a predictable ceiling on your drug costs and ends that fear of runaway expenses for the medications you need. This cap applies whether you have a separate Part D plan or if your drug coverage is part of a Medicare Advantage plan. The system tracks your spending automatically, so you don't have to do anything special to get this benefit other than just be enrolled in a Part D plan. It's an incredible new layer of financial protection for millions of Americans. Now, let's talk about the other side of the coin. Medicare Advantage, also known as Part C. These are the all-in-one plans from private insurance companies that bundle your hospital, medical, and usually drug coverage, often throwing in extras like dental and vision. For 2026, the Medicare Advantage market is buzzing with competition. You're going to see a ton of plans out there, many with very low or even $0 monthly premiums. Super tempting, right? But this is exactly where people make a huge mistake. They see that $0 premium and sign up without a second thought. Here's the thing. The monthly premium is just one piece of the puzzle. A plan with a low premium might have a sky-high out-of-pocket maximum, a network so tight your favorite doctor isn't in it, or a drug list that doesn't cover your specific medications. So for 2026, it's more important than ever to understand your big choice. Do you stick with original Medicare, probably with a Part D and a Medigap plan, or do you go with a Medicare Advantage plan? Those low premiums are flashy, but you've got to look under the hood to see if it's the right move for your health and your wallet. This brings us to the most important thing you have to do this year. You absolutely, positively must compare your plan options during the annual open enrollment period. That window runs from October 15th to December 7th every single year. Any change you make takes effect on January 1st. Why is this a must-do? Because plans change every single year. Your current plan's premium could jump up, your copays could change, and most importantly, the two things that hit your wallet the hardest, the doctor network and the drug formulary, can change. That doctor you love might be out of network next year. That prescription that costs you $20 today might not be covered at all next year, meaning you pay full price. Doing nothing is still a choice, but it can be an expensive one. Your plan will auto-renew if you don't act, but you could be renewing into a plan that's a terrible fit. The good news, Medicare gives you a fantastic free tool for this. It's the Medicare Plan Finder on Medicare.gov. You can plug in your exact prescriptions and doses, pick your favorite pharmacy, and the tool will spit out your estimated total annual costs for every single Part D and Medicare Advantage plan in your zip code. It's the single best way to see, black and white, if you can save money. Hey, if you're finding this helpful, do me a quick favor and hit that subscribe button. The rules change all the time. And my job is to keep you in the loop so you can keep more of your hard-earned money in your pocket. Okay, I need to warn you about a very specific and costly mistake I see people make constantly. I call it the Medigap Trap, and it happens when you try to switch from a Medicare Advantage plan back to original Medicare. Picture this. You've been in an MA plan, but you're tired of the restrictive network. You want the freedom to see any doctor who takes Medicare anywhere in the country. So during open enrollment, you decide to drop your MA plan and go back to original Medicare. You know, original Medicare only covers about 80% of your outpatient costs. So you smartly decide to buy a Medicare supplement or Medigap plan to cover that 20% gap. Here's the trap. When you first turn 65, you get a 6-month federally protected window to buy any Medigap plan you want, no health questions asked. They can't turn you down or charge you more for pre-existing conditions. But, and this is a big but, if you've been in a Medicare Advantage plan for more than a year and you decide to switch back, in most states, you lose that protection. To get a Medigap policy now, you'll probably have to answer a bunch of health questions. It's called medical underwriting. And the insurance company can look at your health history and decide to either charge you way more, delay coverage for your conditions, or just flat out deny you. So here's the crucial advice. Do not drop your Medicare Advantage plan until you have been approved for the Medigap policy you want. Apply for and lock in your Medigap coverage first, then make the switch. So what happens if you pick a plan during fall enrollment and come January, you realize you've made a terrible mistake? Maybe your doctor isn't in the network after all, or your drug costs are way higher than you thought. Are you just stuck for a whole year? Not always. And this is a tip a lot of people just don't know about. If you're in a Medicare Advantage plan, you get a second chance. It's called the Medicare Advantage Open Enrollment Period, or MAOEP, and it runs from January 1st to March 31st every year. During these 3 months, if you're in an MA plan, you get one and only one chance to make a change. You can either switch from your current MA plan to a different one, or you can drop your MA plan completely and go back to original Medicare, and you can add a Part D drug plan at that time. Think of it as your do-over button. It's an amazing safety net. But remember, it only works if you're in a Medicare Advantage plan on January 1st. If you have original Medicare, this special window doesn't apply to you. Finally, let's talk about how to protect yourself. This stuff can be confusing and it's easy to make a mistake. So here are 2 simple rules to be your shield and armor. First, document everything. When you call an insurance company or an agent, grab a notebook, write down the date, time, who you talked to, and what they said. If you get a key piece of info like, yes, Dr. Smith is definitely in our 2026 network, having that note can be a lifesaver if it turns out the information was wrong. Second, whenever you can, use the official government channels. Enrolling right through the Medicare.gov Plan Finder or by calling 1-800-MEDICARE is your safest bet. And for 2026, there's a new protection baked in. If you sign up for an MA plan through the Medicare website and it turns out the provider information was wrong, you'll get a special enrollment period to switch plans. It's an escape hatch if you were accidentally misled. All right, let's bring it all home. The Medicare world is changing, but you are now equipped to handle it. First, get excited about that new $1,100 out-of-pocket cap on prescription drugs. It's a huge win. Second, use the Fall Open Enrollment OCT 15 Deck 7 to really dig in and compare your plans. Third, if you're leaving Medicare Advantage, watch out for the Medigap Trap and get your supplement policy approved first. Fourth, remember your MA plan do-over window from January to March. And finally, protect yourself. Write things down and use the official Medicare website. These steps are your roadmap for 2026. You can take control of your healthcare costs and make sure you're not leaving thousands of dollars on the table. I know this is a ton of information and it can be overwhelming to go it alone. If you want some personalized help, Robin offers a free, no obligation consultation. Just click the link in the description to schedule a chat. And don't forget to download our free 2026 Medicare checklist. It's a simple guide that covers everything we talked about today. The link for that is in the description too. Thanks for watching, and here's to a healthy and financially secure 2026.